Sí, bueno,
Sí.
Recording in progress.
Can you? Yeah. Okay. Okay. Grace, Oscar, puedes abrir votre video si quieres. Good morning, everyone. Buenos días. We need to start in the interest of the agenda for this session, and I want to take the advantage to speak as much as we can with our lovely panelist speakers here with us today. My name is Elena Giannini. Most of you have met me around.
estos días y lidero el grupo de trabajo con la Alianza, co-lidero el grupo de la Alianza y estoy reunida aquí en esta sesión sobre cambio climático y la interseccionalidad del cambio climático con la protección infantil con Marta Keys, de Regional America Director para la Federación Internacional de la Cruz Roja, Sergio Gil Pérez, el director nacional de la Cruz Roja Joven de Panamá, Katie Robertson, quien co-lidera el grupo de trabajo de aprendizaje y desarrollo en alianza conmigo, y tenemos el placer de estar en compañía hoy de Oscar Calero, especialista de protección de juvenil, protección en Perú, y con el socio local de Child Fund Alliance en Child Fund México. A medida que trabajamos el día de hoy y con lo que terminamos ayer, reconocemos el profundo impacto del cambio climático en la protección infantil. El UNICEF reporta que más de 1 millón de niños están en riesgo de ser afectados por el cambio climático en los años venideros. El cambio climático está intensificando el riesgo para la seguridad, el bienestar de los niños, y está causando efectos intergeneracionales que va a ser duradero. Está alimentando el conflicto, el desplazamiento y la seguridad alimentaria. Al reconocer todo esto, entonces la Alianza también reconoce la crisis climática y el cambio climático y la crisis de justicia como una de las áreas claves para explorar, para asegurar de que nuestros practicantes hagan un enfoque adaptado en este contexto. Antes de pasar la palabra a nuestros oradores del día de hoy, quería hacer una pregunta a todos el día de hoy, y pueden responder levantando la mano. ¿Cuántos de ustedes han sido testigos de cómo la vida de los niños es impactada por eventos relacionados con por la crisis, afectada por la crisis climática? Lo pueden mostrar las manos. Es una gran mayoría de las personas en esta habitación y esto nos dice bastante sobre la magnitud de lo que vamos a estar enfrentando en los años venideros. Entonces, sin más, quisiera invitar a Marta Kiss de la Federación Internacional de la Cruz Roja, Marta Kiss, por algunas palabras introductorias. Marta, si podrías reunirte con nosotros, por favor.
You're very welcome.
Thank you, Elena.
Gracias, Elena. Gracias, muchas gracias. Buenos días. A todas las organizaciones humanitarias y sociales, a los que se encuentran presentes, para todos los respetables miembros de la Alianza de Protección Infantil, a todos los panelistas en línea y de parte de las sociedades de la Cruz Roja, quisiera agradecer esta invitación y lo más importante es que felicitarlos a todos por sus contribuciones a la protección de los niños y por organizar esta reunión tan importante, el primero en las Américas. Así que bienvenidos a Panamá. Como todos saben, los desastres climáticos están aumentando en América y en todos lados en el mundo.
Heat waves, such as those currently affecting Mexico and India, devastating floods, as we have recently seen in Brazil and Germany, and droughts and fires such as those that we have responded to in Chile, Colombia, Bolivia, and Guatemala. These climate-related disasters are increasing in frequency and intensity and are a threat multiplier. They are events in their own right, making conflicts harder to manage, exacerbating health crises, and deepening already acute levels of poverty, exclusion, and inequality. Of course, these disasters do not impact everyone equally. Those with resources and power are better able to shield themselves. And ironically, those populations who are already disadvantaged and have done the least to cause the problem are the ones who are impacted.
Son los que son impactados de peor forma. Dentro de esta...
especially girls who already face so many inequalities, as well.
A medida que los niños son desplazados, son forzados a vivir en la calle o a trabajo forzado, o viviendo con incapacidades cuando se trata del cambio climático, los niños y todos seguirán.
Now and for decades to come. It is clear we need to enhance protection for children in climate disasters. In this light, I would like to share with all of you today 3 reflections from our work in the field, engaging with children. First and foremost, we need to listen to children and see them as agents of change. We know that today, children often represent anywhere from 30% to over half of populations affected by disaster, conflict, or epidemic. And yet we rarely hear from children directly or view them as people with ideas and solutions. This needs to change. It's clear from research and practice that children are in fact essential in improving the quality of actions to prepare for, respond to, and recover from disasters. They are agents of change. We have seen this in our own work through regional surveys around climate disasters in a project that we call We Need to Do Better. Over 30,000 children and youth have told us the following. They are concerned about protection, mental health, and access to education during climate disasters, and they want actions to start when early warnings are issued. They want to be involved, but do not always have the opportunities and do not receive child-friendly information. And they're not confident that adults will properly help and protect them. This is our failure as adults. We must find practical ways to seek children's counsel, make room for their leadership, and partner with children on local solutions. We urgently need their brilliance, their wisdom, and their passion. My second reflection is that we need to be localized and scale up our ambition. As the Alliance's survey on climate disaster shows, there are actions being taken by those of us in this room. Local actions are being taken to meet local realities. Yet, these are all too often in isolation, islands of work, and using disparate measurements. Our challenge today is to work together to gather what we have learned to develop more effective local actions, while at the same time better unifying our work with common standards, measurements, and best practices, and only then taking those to scale. As we do this, it will be important to recognize that climate disasters do not happen in isolation, that children live in a world of multiple crises, where climate disasters, conflicts, health crises, and migrations converge, having catastrophic effect. In today's world, children are facing heat waves, the ringing of gunshots, and the spread of illness, one on top of the other. It stands to reason that our tools and measurements need to reflect these realities. And my final reflection that I will share with you this morning is that we need to anticipate and act earlier for our children. Our response to child protection in climate disasters is often too slow. Protection is an add-on only after the cyclone, the flood, or the heat wave has already had its impact. Anticipatory action is an emerging tool for us all, taking early action based on early warnings. And yet, right now, child protection and related themes, like education, are by and large invisible in anticipatory actions. So now is the time for us to include child protection into anticipatory action so that we act early, take preventative steps, and better protect children when climate disasters happen. In this way, when we issue early warnings for heat waves, we can already have systems and local coordination in place so that children stay with their families, continue going to school, are able to access health care, stay hydrated, and have access to protection services. To help move this forward, we want to work with you. We want to develop a support package on child protection and education and anticipatory action with a focus on climate disasters, an effort we hope will allow us to take a unified approach. So these three reflections are not just wishful thinking. Many Red Cross societies in the Americas have made efforts to advance them as part of our climate resilience program. In Panama and Honduras, for example, the Red Cross has initiated the Blue Schools program, a program that aims to contribute to a healthy learning environment by promoting environmentally friendly practices that children can replicate in their communities. It's aligned with the educational plans for risk management in each country and works hand in hand with the ministries of education. Other national societies, such as the Paraguayan and Uruguayan Red Cross, have included initiatives to identify the protection needs of children and other vulnerable groups in their climate resilience activities. In Colombia, the Red Cross is working on a model for community participation to involve children in climate change risk reduction projects, including the creation and validation of early warning systems. So I here today as a representative of the International Federation of Red Cross and Red Crescent Societies, I stand ready to work with all of you to continue striving to protect each child affected by climate-related emergencies. In the Americas and worldwide, we stand with the children. Thank you very much.
Thank you very much, Martha. Such an incredible account of what's already happening, and I think to link with Martha's points, we're gonna go straight in and just ask youth and children who are with us today to answer a few questions for us. So if we can have, please, yeah. So I am gonna pose the questions in Spanish just so it's a little bit easier for our online participants or online speakers. But my first question is for Sergio. So for those who don't speak Spanish, please put your headset on. And Sergio, buenos días. ¿Podrías compartir una experiencia personal?
Could you share a personal experience on how climate change has impacted your life or the ones you know, the people you know?
Sí, buenos días.
Yes, good morning. My name is Sergio Jaén. I am part of the Youth Red Cross in Panama. I live in a region that is characterized by being in the dry area of Panama. This zone and in several areas of the country, we have noticed that temperature has increased and these heat waves are affecting the youth, the children regarding their studying, their time off, before we used to see them outside playing outside. They don't do it anymore because the heat is too high. We're also noticing other impacts whenever they are going to their schools. Children are going to their schools, and climate change that it's sudden has provoked floods, and we have noticed situations and cases where kids have been swept away by floods when they're on their way to school. These situations occur suddenly. You cannot foresee it, and we don't realize the problem we have in hand and that we're going through. Whenever there's a drought, we think about water because water is nowhere to be found, and we know that children are also vulnerable as an impact of climate change. They dehydrate fast. Of course, these affect their health. Those nutrition deficiencies that happen whenever there is lack of water, these affect the agricultural production and production of food. The same thing for hygiene. If we don't have water and we notice it, then to keep the hygiene standards is very hard. So these causes an increase in risk of illnesses such as diarrhea, cholera, etc. So it's evident the effect this climate change has in our lives. As a young man, I know how it has affected my different experiences throughout my lifespan. As a kid, perhaps I didn't understand the commitment or the responsibility I have with the environment. I wasn't aware. Being part of a Red Cross today, I understand my responsibility and the level of engagement that we have as kids and as youth. Each action counts. If I'm at home doing nothing, I don't add up. And if I'm not doing the right thing, I am part of the problem. So children and the youth will realize that our actions and our engaged participation facing climate crisis is needed. Thank you, Sergio. Now the same question to Grace. Grace, could you share your personal experience? Could it be the connection is not... Grace, can you hear us? Would you like... Can you share your experience? Would you like to? Grace, would you like to share your experience on how climate crisis has affected your life or the people you know, the people like to face you know, if you can hear me? Grace, if you can hear us, I will ask the second question. As an activist in young person in the midst of environment crisis, can you share experiences and your point of view on how to do advocacy facing environment challenges? Of course, through commitment and activism with climate change, we learned about the importance of a healthy and a resilient planet. Thanks by working with children with Conaco, um, being children who share information with children, boys and girls, strengthening their capacities and spreading information, raising awareness of the rights for girls and boys, adolescents, and youth all together, including a better environment, ensuring that having healthy environment for kids and youth in our local communities and rural communities to learn the importance of leadership and empowerment for the youth. Thanks to that and to the project My Voice Demands, we have had open doors to limitless opportunities and learning the true value of leadership and youth empowerment. I have been able to develop myself as an indigenous youth in my region. I have worked with the local radio station, with teams. I have participated in challenges with the cause and races. But I have spread our information about the rights of us as youth. I participated in the biodiversity world framework and where I learned the different consequences climate change has caused in this country, Mexico. And thanks to that, currently I am doing little actions today to achieve great changes um, in my school, um, writing books in our native tongue or language to raise awareness and rescue different crops that we have lost throughout time through different small actions. Also, we have mentioned digitalization to reduce paper contamination, and last but not least, um, a workshop to rescue traditional medicine. Not so much as an action against climate change, but to raise awareness, to realize that nature is our planet Earth, is our mother, and as a young activist, I commit to promote climate well-being, inspiring future generations to act with determination and with hope, because we do not need to have a name or a position to move forward little actions, because words say whatever they want, but actions are the ones that prove what you are. Thank you very much. Thank you. Grace?
Muchas
with a lot of hope as well. Really good. Sergio, would you like to add anything to the ideas that Grace have already contributed? Well, the children today confront a lot of programs, which is the migration program. We see one of these realities in which the families and people that leave from their countries, they go through diverse situations and diverse climates, going through the jungle of Darien, and they go through different situations on their journey. It really worries us to see how different topics related to health, mental health, abuse, on their journey. And the lack of stability that is presented in the climate of those that are on displacement or moving from one place to another. We're looking at the topic of climate change as well. We're looking at displacement of populations that were living at sea. We're looking at this occurring in the Caribbean of Panama. There's a community that is completely been displaced. They're having to leave their islands to go onto firm land due to climate change. We're also seeing how the Red Cross helping alongside with the government, how they can do advocacy for this assistance, that it can be in a secure manner and protecting the rights of children. Red Cross is developing, just as Ms. Martha stated, some programs at school that are related to environmental environmental education. These programs have shown that young people and children, they want to participate and they have a lot of ideas, a lot of innovation. They really want to be part of this, not only us telling them what they have to do, but that they can be part of the process and they can help build their own ideas, developing their own skills. Not just telling them, here is a plan and just plant it here. Ask them, what can we do to confront climate change? Also, how can we use waste in a better manner? How can we improve our environment that it can be more friendly, that it can be more green, it can be more sustainable, it can be more resilient? This is very important for us to have this active participation with young people and children. Thank you, Sergio. And at this time, we're going to hear from Oscar. Oscar, I hope you can hear us. Can you tell us about your experience with the program that you have been executing in Peru with the protection of childhood with climate change? Yes, good morning from the International Plan. Sure, we have developed an experience focalized in those who were affected in the north of Peru, 2023, continuing with some actions with this experience exactly occurred on the framework when we had this hurricane as a country, and it's a joint work. It was a lot of flooding, a lot of rain on the north side, and this response program with the integral vision, intersectional with the gaps of the needs of children and adolescents through quick assessments and also for accountability and all the communities that are always attended to at that time. The program had intervention and focalized attention focus on children. It's important to mention that these actions were alongside with other stakeholders and other actors, the state, other agencies that are having presence in the sector. Alongside, continuously, they were assessing how this emergency was evolving. Also, we had a wide scope of communication, protection services on behalf of the states. In the framework of the emergency, it had been weakened in the rural section. There were key elements for us in this experience, and it was that we got to identify the needs and the gap of all childhoods who were involved, how the crisis was impacting them, how it was adding more gaps other than the ones that were already existing, and how this has been generating other lacks, problems that have been highlighted based upon age, climate conditions that were being confronted, territory, the displacement. So the model included 6 key elements for us in this model. And the first one that had to do with generating secure and friendly spaces implemented from the community. This was a work in which we were looking for the children and adolescents could understand the event, that they can understand where the situation occurred and the climate change impact, and from there strengthening their capacities of resilience to generate and find opportunities, certain practices in the future, emotional support, and how to confront violence that gets exacerbated in these type of situations. In this second element that was also worked is self-care and self-protection with children and young people, emphasizing on incorporating an intersectorial focus to understand the needs that the children.
Y esto ha pasado también por un proceso de reconocimiento de los riesgos que la comunidad les otorga por ser niños, por ser mujeres, por no tener grupos de apoyo, por encontrarse en una condición de pobreza extrema durante un proceso de crisis y por el tener
level that they can be part of the response. And those gaps, exacerbated gaps, can appear. They strengthen local capacities for future scenarios that can occur because of climate change. This was done with the local government. And initiatives of protections have been established based on the components of WASH. Intervention, a multi-sectorial intervention is opportunity to protect boys and all this has been done hand in hand that we can recognize the situations that affect boys and girls, accompany them for the identification of cases. But more so, I think that one of the biggest retributions based on this experience has been to recognize that at the end of the intervention, communities have more capacity to respond. Thank you, Oscar. Very interesting.
Ask Oscar, Grace, and Sergio a few more questions after. But first, I would like to invite Katie to present the preliminary results of our learning needs analysis on child protection and intersectionality with climate crisis. So I leave the floor to you, Katie.
Hi everybody. So the Learning and Development Working Group at the Alliance and the Climate Group of Friends have been working together on a learning needs assessment of the intersectionality of climate crisis and child protection. So we're trying to understand what are the key knowledge and skills that child protection practitioners need in order to prevent and respond to the risks and impacts of climate crisis on the safety, protection and well-being of children in humanitarian settings. So I'm going to share with you some of our findings so far, but also going to ask for you some of your inputs. So if everybody could please, on your phone, go to menti.com and put in the code, the numbers at the top of the screen, so you're ready when we get to that question. That would be great. We have conducted an online survey that's already closed, so most of the findings that I will show you today are from the survey. But we're also doing some focus group discussions which continue over the coming weeks, and we'll be doing a desk review of any other research or learning resources that are already available. So I'll talk a bit more about the next steps shortly. Okay, let me see if I can work these buttons. Okay, so in the survey we asked what are the three main impacts of climate crises on the protection of children in your context. So in the Menti, we'd love you to tell us what you think the answers were, or what in your context, what are the three main impacts. So this is just the question. It was too long to fit on the next slide. And then you have some options to choose from. So I'm just going to give you a moment to vote. Interesting. Okay, great. You can keep voting. I'm gonna keep going. I'm gonna show you what the survey told us. So from the survey, we found that the main impacts were an increase in negative coping mechanisms. So this included child labor, child marriage, trafficking, and child recruitment. All of the
Y todo resultado de la pérdida de la manera de vivir, disrupción a la educación, interrupción de la educación y separación familiar debido al desplazamiento. Entonces estos salieron como los tres principales debido a falta de subsistencia, medio de vida. Entonces la falta de acceso a servicios. Luego le preguntamos si estaban debido a la crisis climática y 51% de los médicos dijeron que sí. Les preguntamos qué ejemplos pueden compartir en cuanto a adaptación. Entonces le voy a mostrar las cosas principales que salieron en esa pregunta. Las 4 cosas principales: elaborar estrategias guías.
So, for example, including climate-related risks in vulnerability assessments and situation analyses. The next one is adjusting the physical environment in which child protection activities take place. So this might be moving activities indoors, out of extreme weather, providing cooling or heating systems, or changing the hours in which activities are taking place. And then we had awareness raising and educating on climate risks. So quite a lot of examples of designing educational games for children and young people to understand what to do, for example, in case of a flood. And educating children and families about preventive measures and healthy behaviours to take following and during climate crises. And then the fourth one was engaging the community in climate activism. So, for example, developing joint adaptive strategies with communities to protect children during climate crises, or supporting communities to take practical preventive measures like tree planting or recycling. For the 49% of our respondents that had not got any examples of adapting their programming, we asked what the barriers were preventing them from making these adaptations, and this is what we found out. So lack of funds came out as the most common barrier, just by a tiny bit, and then lack of knowledge on how to do that, how to make those adaptations, and lack of staff with the relevant knowledge and skills both came out really high. And then it not being an organizational priority is the one on the far left. And then it not being relevant in the context came out very low, as you can see. So lack of knowledge and skills clearly comes out as quite a big barrier. And the LNA is seeking to determine what are these knowledge and skills that we need to fill this gap. So another question for you, based on what you heard from the keynote and from the panel, and from the LNA findings so far, we'd love to hear what you think are the key knowledge and skills that CPHA practitioners need to address climate crisis in their programming. So this is the question. And then there is just an open, I love it, someone's already there, just an open text box, so you can write in English or Spanish and let us know what you think. I'm just going to give a minute for that. Amazing. This looks great. I see some common ideas that came out of this survey as well. Excuse me. Please do continue adding. I'm going to show you what the survey told us. So the main knowledge and skills needed, according to the survey, for CPHA practitioners to better address climate crisis in their work are understanding the impact of climate crisis on children, analysing the risks and vulnerabilities associated with climate crisis, identifying prevention and mitigation measures, and then knowing how to adapt their child protection strategies. So we are continuing the assessment over the coming weeks with the aim of sharing a report in early September with the full findings and recommendations on next steps for capacity strengthening in this area. But one last request from me. If you have any experience or examples of working on climate adaptations, we would love to speak more with you. So if you do, and you would be happy to take part in a focus group, please scan this QR code and you can sign up for the focus group. And we will keep you updated with what else we learn. Thank you so much.
Thanks a lot. And to our technicians, if we can bring back Grace and Oscar. Tengo otra pregunta para Oscar y Grace. Lo siento, para Sergio y Grace. Sergio, quería saber, como activistas, ¿qué cambios o mejoras cree que los profesionales de nuestro campo deberían priorizar para abordar mejor los desafíos de protección que enfrentan las comunidades afectadas por la crisis climática?
Sabemos lo que pasa, sabemos a lo que nos estamos enfrentando, pero muchas veces trabajamos de manera separada. Debemos de trabajar en conjunto, debemos de crear mayor participación comunitaria, que sean las propias comunidades las que nos hagan saber cómo podemos hacerle frente a las diferentes problemáticas. Como organizaciones, como instituciones, debemos de trabajar de la mano con los estados para crear políticas sostenibles que sean adaptadas a los diferentes escenarios o las diferentes situaciones que viven nuestras comunidades. No, las comunidades a nivel del mundo no son, todas son iguales, todas viven realidades totalmente diferentes. Por eso es importante no generalizar todo y escuchar una por una para atender esas necesidades que viven cada una de ellas. Debemos de tratar de involucrar más la participación infantil y de los jóvenes. Tienen ideas maravillosas. Yo he escuchado a los que están aquí compartiendo diferentes espacios en esta reunión, también en nuestros programas, en nuestras actividades, en los clubes de desarrollo sostenible. En muchos lugares he visto cómo los jóvenes alzan su voz y dan ideas muy innovadoras, muy fabulosas, y no las atendemos. Están allí, esas ideas están allí, y nuestras organizaciones, nuestras instituciones, debemos de buscar, debemos de escucharlos y debemos de darles un soporte, tratar de brindarles una respuesta y un acompañamiento a estos jóvenes y niños que tienen ideas fabulosas para hacerle frente a la crisis climática. Sabemos como profesionales cómo poder preparar a estos jóvenes en cuanto a lo que son los temas de protección, inclusión, que permitan pues que sean estas necesidades atendidas de una manera más digna, de una manera más participativa. Es importante que los niños pues sean tomados en cuenta también desde los roles de liderazgo, que sean ellos pues parte de la toma de decisiones. Así que yo pienso que nuestras organizaciones pueden trabajar en conjunto, escuchando a los niños y colaborando con los estados, con los gobiernos, para crear esas políticas sostenibles.
Gracias, Sergio. Grace, ¿quieres ayudar algo?
Claro, puedo decir que primeramente debemos de comenzar a sustentar los datos que se manejan en la actualidad. En este caso me dirijo a la Agenda de Desarrollo Sostenible, con objetivos específicos que deben ser alcanzados en los próximos 6 años. Voy con el objetivo número 13, acción por el clima, y con el objetivo número 17, alianzas para poder lograr los objetivos. Es crucial una acción urgente y transformadora que vaya más allá de meros planes y promesas. Se requiere aumentar la ambición, abarcar economías enteras y avanzar hacia un desarrollo resistente al clima, comenzando con pequeñas acciones en todas las partes del mundo. En este caso, me enfoco a las localidades rurales. Desafortunadamente, aún existe la falta de apoyo de los gobiernos. No reconocen que nuestro rol es esencial. Los pueblos indígenas somos los protectores y guardianes de la madre tierra. De ahí deriva la vulnerabilidad de niñas, niños y adolescentes, pagando las consecuencias del cambio climático, pues los vientos y las lluvias intensas han llegado a provocar sequías, dejando a familias sin alimentos, sin ingresos económicos, siendo la agricultura su única fuente de subsistencia, caminos obstruidos por deslaves, impidiendo la educación, la contaminación del aire y la falta del agua han provocado deterioros en la salud, fiebre y bienestar, causando la deshidratación, golpes de calor y sobre todo afectan su seguridad alimentaria. siendo esta la base para permitir el desarrollo de su potencial por dependencias nutricionales. Entonces, la limitación potencial de estas condiciones nos dejan en desventaja frente a oportunidades con respecto a otros jóvenes con mayores posibilidades de crecimiento. Entonces podemos decir que la necesidad es urgente porque queremos agentes de cambio locales que no sean impuestos por áreas urbanas, que sembrar árboles debería de ser una ley aprobada por el Poder Legislativo, que sean personas que realmente conozcan las necesidades que nosotros sufrimos a causa del cambio climático, porque es muy diferente el conocimiento a la experiencia. Y por último, mejorar las alianzas con autoridades locales, organizaciones, buscando el bien común y no el económico. Gracias.
Gracias, Grace. Oscar, ¿quieres ayudar algo? Algunas ideas, recomendaciones por nosotros profesionales de la protección de la niñez.
Claro que sí. A ver, algunos aprendizajes que hemos tenido durante ese trabajo y que nos gusta compartir es que siempre que podamos trabajar en temas relacionados a el clima, un elemento clave es partir de los saberes que tiene la comunidad. No podemos pretender que personas externas, actores externos, llegamos a las comunidades y llegamos con una respuesta, con un manual, una guía bajo el brazo. Un elemento clave para nosotros es reconocer los saberes previos, el poder aprender también de las propias comunidades, porque ellos tienen su propio entendimiento de la situación, porque son ellos los que viven, son ellos los que impactan. Y parece mentira, pero a veces el vínculo que tienen con la tierra, el vínculo que tienen con la naturaleza, les da también a ellos saberes que nosotros no tenemos. Entonces, una recomendación es toda intervención a partir justamente del reconocimiento y de la experiencia que tienen las propias comunidades, pero también, por otro lado, es importante que en cualquier trabajo que vayamos a hacer, partamos también de reconocer cómo les afectan a cada uno de los miembros de la comunidad estas acciones de cambio climático. Porque dependiendo dónde estemos posicionados, dónde estemos colocados dentro de la misma estructura de la comunidad, podremos tener también mayor o menor afectación. Entonces no podemos pretender hacer programas que son estandarizados, porque algunas veces simplemente se convierten en paliativos y lo que buscamos es generar una atención integral. Lo otro es que también una recomendación es que todo programa de protección que se trabaje tiene que tener el componente de apoyo psicosocial o socioemocional. Y tiene que estar pensado no solamente para aquellos que se han visto afectados de manera directa, que son las personas de la comunidad. También hay que pensar que los servicios del Estado, que los operadores, que los funcionarios que están alrededor de estas comunidades también se pueden haber visto afectados y eso impacta en la calidad del servicio que pueden brindar. Pero también en el personal que va a trabajar en estas comunidades, porque no siempre estamos preparados para poder asumir toda la carga emocional que las personas, cuando comenzamos a establecer un vínculo con ellos, nos van trasladando en sus necesidades diarias, en sus dudas, en sus inquietudes, en su, quizás, en el temor hacia el futuro y que les depare, ¿no? Entonces, para poder acompañar estos procesos es clave para nosotros. Y por último, es fundamental que cualquier tipo de intervención de protección no sea una mirada simplemente desde el sector, sino que sea una mirada más abierta, multisectorial, interagencial, en trabajo colaborativo con otros clústeres, en donde más bien el personal de protección a la niñez debe estar presente siempre para poner esa mirada de protección, esa mirada de identificar esas brechas y encontrar las oportunidades en cada intervención que podamos tener desde agua, desde saneamiento, desde lo que es la administración de campamento, en cualquiera de ellos. Y por último, creo que un elemento que ya han mencionado están los jóvenes que nos han acompañado es el tema de la participación. O sea, es clave que todo proceso, todo trabajo que se desarrolle no para las comunidades, sino con las comunidades, con la participación de ellos. ¿Ok? Porque la única forma de que las actividades, las acciones y que los cambios sean sostenibles es cuando la propia comunidad, y especialmente los niños y los adolescentes que tienen esa fuerza, esa capacidad de resiliencia enorme para enfrentar esas situaciones, se hacen dueños de ello. En esos casos es cuando podemos asegurar que toda la inversión que hacemos para responder a una situación de protección en el marco de una emergencia, en el marco de acciones preparatorias del cambio climático, van a ser sostenibles y van a poder ser compartidas con otros. Hay un enorme potencial que tenemos que visibilizarlo y siempre tiene que estar en nuestras agendas. Eso, compañeros. Gracias.
Gracias, Oscar. We are there with time, but I want to give the opportunity to at least ask one or two quick questions, like to the audience, if Manami allows. So if there are one or two questions from the audience, we're happy to take them. See, I think we have two. Daniela or Katie, if you can help us with the translation into Spanish so that the receiver of the question can understand. Yes, we have a question there.
Buenos días, muchas gracias por la intervención. La niña mexicana habló hermosamente. Una pregunta de preocupación. La crisis climática es un efecto del modelo de desarrollo y también hemos visto en Colombia un retroceso en los derechos y en las luchas que se han hecho. Por ejemplo, después de haber logrado una gran procesos de saneamiento básico en las zonas rurales, con la crisis climática que tuvimos ahorita, que estamos padeciendo el fenómeno del Niño, la gente tiene que volver a guardar agua. Y guardar agua, ¿qué significa? Dengue y otras enfermedades que además los niños ahorita están con menos resistencia al antibiótico. Entonces son una serie de secuelas que van a tener los niños. Van a tener problemas estomacales porque están consumiendo agua. Entonces, ¿cómo llegar a esos puntos donde ha habido un retroceso de derechos y unas luchas que se habían logrado?
Oscar, ¿quieres intentar de responder un poquito?
A ver, desde la experiencia que hemos tenido nosotros, es cierto que siempre encontramos ciertas barreras desde la propia gestión que tienen a veces los sectores del Estado. Y algo que nos ha tocado siempre es que, si bien tenemos intervenciones directamente con las comunidades, entendemos que la sostenibilidad de lo que podemos hacer depende mucho de la voluntad política de nuestros estados. Y una de las cosas de las que nos solemos enfrentar muchísimo en estos retrocesos es que se suelen dar por los cambios de autoridades constantes, los cambios de las políticas de gobierno, el gobierno de turno, que no siempre tiene las mismas prioridades que la población. Y una de las cosas a las que nosotros siempre apostamos es que todas nuestras intervenciones tratamos desde el propio terreno de poder integrar a los funcionarios del Estado. Porque a veces normar, generar protocolos, lineamientos, acciones desde un escritorio lejano a la realidad de las comunidades es muy fácil, pero no se dan cuenta que generan nuevas brechas para las propias comunidades. Entonces, una de las cosas que nosotros hemos apostado últimamente es que, por ejemplo, en estas evaluaciones que hacemos para las intervenciones, en estos trabajos que hacemos en comunidad, siempre solicitar de una manera coordinada también la participación de los funcionarios del Estado en términos de que ellos, pedirles a ellos que nos acompañen, porque nos gustaría tener también la mirada propia del Estado de lo que estamos haciendo y aprovechar en esas visitas para que las propias comunidades hagan no solamente una rendición de cuentas de lo que han venido haciendo con nosotros, pero sobre todo procurar que se generen agendas que puedan traspasar esa acción para que se establezcan mecanismos en donde se puedan abordar estas situaciones que se van dando. El tema de la escasez de recursos híbridos es un tema que que afecta muchísimo también en Perú, porque nosotros somos un país en donde en toda la costa no llueve y siempre estamos enfrentando, como no tenemos lluvias, siempre estamos enfrentando el problema y siempre estamos a un paso de generar crisis. Se me ha ido. Entonces, mucha del tema de la incidencia va por el generar algunas acciones o tener servicios que puedan prever justamente este tipo de situaciones. Pero no es fácil. No es fácil porque no siempre los estados caminan del lado de nosotros, no siempre los estados nos miran con buenos ojos en términos de creen que somos alguna competencia o creen que estamos en las comunidades y que exacerbamos algunos de los estas necesidades y brechas cuando comenzamos a hablar justamente de ejercicio de derechos. No siempre lo ven, a pesar que son los garantes, no siempre nos ven. Entonces, importante que nos vean como aliados, porque algunas veces no hay la capacidad técnica en los gobiernos locales para poder establecer. Entonces, ponernos al servicio de ellos y tratar de llevar siempre el tema de no de cubrir la necesidad, sino de ejercer el derecho. Creo que por ahí para nosotros eso nos ha facilitado en algunos momentos este tipo de intervención con ellos, ¿no? Eso nada más, gracias.
Gracias, Oscar. Super veloz. Sandra, ¿quieres? We can take one more at time. Good. So, well, just my closing remarks. First of all, let me say thank you to Sergio, Marta, Oscar, and Grace. It has been amazing, like, to work with you all. I'm sorry, we are at time. It has been amazing to work with you all in the preparation of this session. I've learned a lot, and I have many ideas that come from what you have explained to us. What I perceive from all of this intervention is that the challenges ahead are to be tackled in a 360 degrees way, where no one can actually face those challenges alone. So it's going to be the effort of governments, communities, children, youth, international organizations, humanitarian actors, development actors, etc. So it's going to be a great coordination push that we will need to make, and keeping those hopes open for the youths and the children. And I thank you all again for your participation in this session, and connect with us for more. I think it's break time. So I think we have coffee downstairs. Yeah, that's over here. Pedro says, on this floor, so you'll be able to access some coffee over there.
So we are going to 20 minutes break from now, and please go to the app to check the next session. And I think you have more questions to ask, so please use the break time to ask more questions to the speakers. Thank you.
Vamos a probar.
In my dreams, all the time, I dream of you.
1, 2, 3, 1, 2, 3. 1, 2, 3. Good morning, if you can hear me. One, two, three, 1, 2, 3. 1, 2, 3, 1, 2, 3. Can you hear me? 1, 2, 3. 1, 2, 3, 1, 2, 3. One, two, three, 1, 2, 3. 1, 2, 3, 1, 2, 3. 1, 2, 3. Can you hear me? 1, 2, 3, 1, 2, 3. 1, 2, 3. Can you hear me?
Buenos días a todas y todos. Buenos días, ¿cómo están? ¿Bien? No escuché, ¿cómo están?
Very good. That sounds very good. Thank you very much for joining us in Child Fund International. Joining us, my colleagues and I, we're going to try to make this session an interactive one. But above all, we want to leave you with our experience, our motivation to do this job, which we find the most inspiring, and that throughout yesterday and today, we know that if we have passion and deliverance, and we hope that you find that in our words, and we'll help with the challenges. And we're sharing this panel of diversity, and all the spaces where we are, they should be so in this way. So we're very proud to show you what Child Funds does in the region.
Thank you so much, Maria, for this great introduction. So yeah, Maria and Ceci, can you please have a seat so we can start doing our introductions? Okay. So how do I put the slide? Aquí. Thank you. All right. So, okay, Maria. Thank you. Sorry. All right, so I'm going to start with introducing myself. My name is Khadija Al-Sharif, and I'm the Child Protection Advisor at Child Fund International. And today, we will be talking to you about our different Children on the Move programs. So I'm accompanied with Maria de Mora, who is our Senior Project Coordinator at Child Fund Ecuador, and Ceci Ortiz, our Project Manager at Child Fund Mexico. I feel like I'm a bit echoey, so I don't know, like, okay. Is it okay with everybody? All right, brilliant. And not to say the least, the driving force behind all of our Children on the Move program is Radwa Al-Mansi, who is the Director of Protecting Children in Crisis at Child Fund International. She could not be here today, but she's here with her heart. So, okay, all right. So today we will be going through our evidence review that we have done on our 3 main Children on the Move programs in the Americas. We will go through it quickly, and then we will have a deep dive into 2 of our flagship programs, the Lives in Dignity and the Protective Passage programs. And then we will have an interactive activity with all of us. So I hope you guys are fresh in the morning and ready for that. Okay, So basically, what we have done in our evidence review is that we reviewed evidence from 3 projects operating across Central and South America and Mexico as well. And we try to really demonstrate the programs across all of the migration cycle. We try to provide comprehensive support to children on the move for the past 7 years. And we use those results, and this is what we're hoping for, is to use those results to really try and communicate them, to be able to inform best practices, to be able to expand on them, and make it as scalable as possible. We use a standard method for our systematic review for each of the evaluations of those 3 programs. We used interim and final evaluations, progress reports, we used monitoring tools, and then we combined all of those evaluation studies and conducted this evidence review. And we used those results through pre and post outcomes. All right. So the first project I'm going to be talking about is Confio. Confio is mainly focused on prevention. It was actually funded by the Government of Canada, and it took place from 2017 to 2020. And it took place in Central America, in Guatemala, Honduras, Nicaragua, and El Salvador, and in Mexico as well. Confio really tried to work on the pre-migration stage of the migration cycle. So it is at the heart of prevention, and we try to improve the well-being of children and youth who are at risk of migration. We try to support and create livelihood opportunities, for example. We try to provide scholarships, apprenticeship opportunities, linking youth with formal jobs and internships, and also engaging their local civic engagement as well. Throughout doing that, we also built the capacity of the social service workforce and tried to develop child-friendly materials to be able to enhance the livelihood and the vocational training of the youth. And through that, we also, of course, put the child protection at the heart of that, so we included components of violence prevention within all of those child-friendly materials. For protective passage on lives and dignity, I will just give a glimpse because I will leave those 2 beautiful ladies to really dive into them. But protective passage is also one of our really flagship programs of Children on the Move. It is funded by the U.S. Department of State PRM. It took place from 2021 to 2022, and it really worked on protecting children during the migration, so in transit youth. So this is kind of like, the second stage of the migration cycle, and it was specifically in Mexico because Mexico is a country, of origin, transit, return migration, and internal displacement. So what we try to do is follow and really mainstream child protection within this program. We try to provide comprehensive care services. We supported existing shelters, created pop-up ones, placing technical professionals, for example, like social workers and lawyers, to support the referral and the processing of any child protection cases. And by really putting child protection at the heart of this, we try to provide all of the necessary basic needs. So through service provision, such as like accommodation, education, safe spaces for children, and comprehensive care services that included different professionals, so nurses, psychologists, lawyers, doctors, and so on. For lives and dignity, and you can see how we're like moving from one stage to another throughout the migration cycle, which we quickly give a glimpse on as well. Lives in Dignity is a cross-country program. It took place between Ecuador and Peru, and it was funded by UNOPS and the EU. We try to build productive and protective communities at actually both the host and the migrant communities. And this is something Maria will also deep dive into. And what we try to do is combine economic strengthening with child protection together. So we worked with the whole community. And at Child Fund, we usually follow a systematic approach. And we go through all of the different levels of the ecological framework. So we try to work really with the child, with the children, with the youth, with their families, but also with CSO, all the different civil society organizations, the local communities, the official stakeholders, everybody. And we tried to mainstream child protection through all of this, but also following and integrating, more importantly, a gender and inclusive approach. And this is something that we will be also touching upon. So just a glimpse of what we've done. We facilitated the creation of jobs and apprenticeships, for example, and startups. We reduced all of the different institutional, economic, and social barriers to education. And we included, of course, the educational component, which we will be talking about in depth. We created safe spaces and protective spaces. And we also try to really put all of those different protective methodologies through both the host and the migrant communities throughout. So, all right, so this is the cycle of migration, and as you can see, like we put here each of our programs and which stage of the migration cycle they lie in, and you can see that although each of those programs were initially targeted for one specific stage, as a matter of fact, throughout the implementation, we really realized that it covers more than that. Right, so for example, we've got the Confio in our pre-migration stage, transit, and arrival and integration, whereas we have the protective passage in transit and integration and return, as well as the lives in dignity as well. So among the common program characteristics, and I deeply apologize for the font issue, something happened with the transition and the presentation over here. I promise it was not like that, so yeah. So among the common program characteristics, again, as I just mentioned, we really tried to cover all aspects of the migration cycle within the program. So even though they were specifically intended to one stage, but we holistically try to address all within or throughout the implementation of the program. So we try to reach the aspects in general, the key aspects of the cycle of migration, and that was key during the implementation. So this is like the transit, arrival, integration, and return section. So for the localization approach, and I think this is something that we have been hearing over and over again throughout this week, and the importance of the localization approach, and I really cannot really highlight enough how the capacity strengthening of local partners were key, and the local community members as well were key during our program implementation. And the child protection mainstreaming throughout the educational support was truly invaluable throughout our programs. We provided basic support, so like providing just books and toys for children, but we also took it more on the family strengthening and the parent engagement. We included violence prevention in schools, for example. We tried to enhance awareness and enrollment regardless of the immigration status or the documentation of the child. We really tried to work on dropout prevention, teacher training, including also emotional regulation, inclusive education, and so on. This is actually where I really want to try and focus on. And the font is really getting to me, but I apologize. So I will start with protection. These are like the positive program outcomes that we have really found out that shown, like they were shown during the evidence review. So with protection, we have found an increased access to services. So there was a 32% increase among gender-based violence survivors who started receiving referrals and information on GBV services. And another statistic that was actually quite heartwarming was that there is a 37% increase percentage of increase in feeling safe within shelters. And I don't want to just keep saying numbers. I will actually ask Ceci to just give us like a very small story behind this 37 increase in the feeling safe in shelters. So, Ceci?
Muchas gracias, Cadilla. Y para esta parte me gusta.
Thank you very much. And for this, I would like to share the story of a trans woman who, and I would like to read her story. She says, I started this path alone. Along this path, I have felt very lonely, unprotected, and this help and accompanying you have provided have been good. I have felt part of a family. I feel people who's aware of my situation and who's willing to help me.
All right. So with migration and the knowledge and attitudes, we've actually found that 2/3 of youth reported higher knowledge of irregular migration risks. And something that we did not intend, or it came out like as a surprise for us, is that 25% of youth actually reported a reduced intent in or to migrate in the first place. They have shown reduced belief that their lives would be better if they migrated, so they actually had a lower intention in, to migrate. For youth agency, we have had 24% increase in community civic activity participation. And for livelihood strengthening, we've had 2/5 of the youth who reported being employed towards the program's end, whereas over 1,210 displacement affected persons have received livelihood support and actually reported entrepreneurship as well. And last but not least, because I'm a mental health advocate as well, and a community psychologist, so I really believe that throughout our child protection principles of do no harm, we can't really do any of that without considering the mental health and the psychosocial well-being of children, youth, their families, and the communities. And so just to give a glimpse on the mental health and psychosocial well-being outcomes, we have seen an overall enhanced mental health among all of community members. We've seen 35% reduction in children reporting mental and psychosocial distress symptoms, and from 0 to 216 children have reported reduced diagnoses of special educational needs, and they have received services that were complemented with therapy. 2,504 persons received psychosocial support services, and as part of also caring for the caregivers, we didn't only want to focus on the children but also for their caregivers, so we've incorporated teachers' mental health and well-being as well. And we have teachers who were open more to learning about mental health and self-care strategies, with a beautiful percentage of 39% reduction in anxiety and stress symptoms for teachers, in which actually was measured during the using the Beck anxiety tool. So Maria actually has also a very short story about one of the teachers. So Maria, would you like to share it with us?
Yes, I'd be pleased to share with you this story. Many of us who work with children, we come along teachers. They have an educational community of 2,000 students. They have students in the morning, in the afternoon, and they have only a single person in the psychology department who can address and help mental health for kids and girls and boys. When we arrived, there were 42 teachers. Half of them were one group and the other 21 were another group. When we tried to mainstream it and to address stress and everything that generated after the stress and everything that they go through as teachers, we were able to reactivate the dialogue in that educational community. And we have one person, Mrs. Normita. She said, when you arrived, we realized that talking is important because many times silence destroys educational communities. If the teachers are silent, you can imagine how silence will be among students. If the teacher is not part of dialogues, they won't dialogue either as a student.
Maria, thank you. All right, so just to wrap it up really quickly, we have got like a couple of lessons learned throughout our 3 programs. One of them is the extended implementation period. So this is something that we've realized is very critical in order for us to have the necessary time to build the relationships with the local actors and the local partners and the community members. Sometimes because of the humanitarian funding, we are required to do things in a rush, but we really are asking for extended times to be able to really implement and actualize this localization approach that we are all trying to work with. We have had direct community engagement as well. This has created increased actually accessibility and acceptability of the programs. We've had partnerships with relevant authorities and stakeholders, and such actually created a sense of sustainability within our programs, because even if the funded program is over, even if Child Fund is not there within that community, for example, the more that we have those partnerships, the more that we can try and ensure this sense of sustainability, because as organizations have, for example, a high turnover, this sort of partnerships may really ensure the continuity, maximize the efficiency, and avoid any duplication, for example, or diverging approaches as well during program implementation. For the interinstitutional coordination, it's shown to be very critical, because to address the holistic well-being of the child and their families during migration, we really need to address all of the different needs. And to do that, we need the support of all of the different institutions that we can have on the program as much as we can. And all of those 4 components that I've just mentioned are all key to our localization approach. So working in general with strong local partners and organizations is really key for program success and progress, for flexibility, for responsiveness to any changing of the context. So it all lies within that specific theme. And again, as we have seen, this is an emerging priority that keeps popping up in each of the different sessions. I will end by saying quickly the audio-visual communication and art-focused interventions were also a key lesson learned of how this can reach communities that, again, would not necessarily respond as well to the different forms of messaging. And we actually had a very interesting example when during one of the lockdowns, because of the security situation, we have had a theater and we've engaged a theater for all of the different youth to address teenage pregnancies, which has shown major success. Smart indicators as well, reflecting all of the migration cycle. We need to work better on that in our coming programs because we need those smart indicators to access all of the different migration cycles, even if it was not intended initially, but because we have realized that there were effects and there were outcomes that were not necessarily intended for certain migration stages, but were, as a matter of fact, reached. And also, one other thing is that when I say here, like applying a gender and inclusive approach, we have been able to measure our gender indicators because we've included them. However, even though we've had successes, for example, with children and youth of the LGBTQ community, we were not necessarily able to capture this in terms of numbers because we did not include such indicators. So this is also like a lesson learned for us. So for smart indicators, it also has to be inclusive and again, like going back to the applying a gender and inclusive approach, it has shown to be key, and we will be diving more into the gender approach in the programs. So I've taken very long, so now I would like to please move on to my colleague Maria, who will be diving into more. Okay.
Pues bien, vamos a pasarnos ahora al español en
Very well. At this time, we're going to go on to Spanish. And we have a little video we'd like to share. At your tables, you have the material of our results in regards to the management of child fund, humanitarian child fund. So we have the capacity statement of Mexico and Ecuador. There you can see the numbers that Kabilha has spoken about, the activities and strategies that we have started. Let's start out with the video from Ecuador, please. In Ecuador, migrants and refugees go around freely.
Mi emprendimiento es confeccionar bolsos, mochilas, monederos, todo lo que referente a eso, ¿no? Las capacitaciones de Child Fund me ayudaron mucho.
It helps me a lot because of doing an easy bag that didn't have anything fabulous. I started doing some bags, some purses that were just beautiful. Thanks for the support of the migration and financing of the cooperation. It's the integration of migrants from Ecuador. The interpreter greatly apologizes. I'm unable to hear the audio clearly. So, and the people, the interpreter greatly apologizes. The audio is not coming in clearly. And thank you for
26 niños y niñas de 5 escuelas públicas en la ciudad de Ambato.
So the community program, what it does is to help verify the most vulnerable areas, especially children, migrants, and those who we are forced to take care of and protect. Thank you for the support of the migration centers and financing of the United States of America. In 2021, they had capacities with volunteers, adults, and others that are elders. Thanks to the trust and financing from our donors, child funds build communities that were secure and protective, accomplishing that families have a means of living and childhood will feel inclusion and education. We want to invite you to support the inclusion without the nationality and the situation that you might have as migration with the construction of communities of peace, enriching diversity. Thank you. As you can see here, we have the testimonies of the 3 areas of our work. In the upcoming slides that we're going to share a little bit more profound on lives with dignity. Let's go ahead to the upcoming slide. As it had mentioned, it has financing from UNOPS and also from the European framework. And the work that we have on the territory, the humanitarian assistance toward development, it has worked the best. For those who know the reality in the region, Ecuador is a very important country of transit for migrants. We have had many migrant waves starting for the Ecuadorian. It's a population that has always been a migrant. We're having the second wave of migration leaving from Ecuador. We have received a lot of people from Colombia. They have 60,000 refugees recognized from Colombia. And currently, we have around 500,000 Venezuelans at our territory and refuge. And how is our work? We have economical inclusion and we work on means of life in livelihood. And the second one is inclusion in education. And then we have a parent a father, a child working closely, promoting security and protection at schools and also in the communities. And we have the protection and its development. It's like connecting finally the well-being of boys and girls in the communities with the development and how migrants can be seen as people that contribute to the places where they arrive or those whom are looking for a better way of life. In Peru and Ecuador, we're in Cuenca and in Guayaquil. This is in the south of Ecuador, where I come from, and in Peru, in Libertad and Piura. So we want to show you in the next slide how the strategies have been a challenge, because what we have done is work with alliances and with partners. First of all, we all agree that the national authorities and the local governments, the Ministry of Education, Childhood Protection, are indispensable for this type of work, just like the other NGOs. In Ecuador, fortunately, we have the work very well developed, the work on refugees and migrants, and the mechanisms of work table divided by sectors, tables of WASH, and to make it more dynamic as organization based upon the first challenge. What do we work on in depth? An area related to training, another one related to investigation, and another one with innovation. Let's start off with training. Just to reflect that the humanitarian workers, we realize that training is thought of always for people that are going to be there on the long run, whom are residents who are there long term, can study 6 months, a year, to get to do something. But migrants, let's say a mother or a person in charge of a home of a migrant or refugee, it's not a reasonable time frame. So we cannot give them skills for entrepreneurship and also to work. Because this works with the traditional programs of training for work and employment are not appropriate with a migrant mother that has children and she has to take care of them and does not have a supporting system while she goes and study. So it is very important for us, the learning what's done through universities, that they can open these possibilities with certified training and sensitive to the situation of the migrant mothers. In regards to investigation, I think that all the humanitarian workers whom are here, we recollect data, we do surveys, and we have an immense amount of non-processed statistics that have not been analyzed and not compared. For us, this is the first challenge in this project because we have gotten a chance to get involved the Catholic University of Peru and also of Cuenca, the Faculty of Social Science, that they can do some binational studies. With this information that we got, what do we do? What do we do? How many of you have gone back and check of the diagnosis and the prioritization of who's going to participate in the program, who need or who not, have written in evidence that can reflect, look, this is what's happening. Look at what's happening with the children. Look at the risk. We are finding, what are we finding on the terrain? We're going to give them the humanitarian part. We're going to reach out to them to control the shelter, to give them an opportunity of entrepreneurship. But where is this evidence published? Nowhere. And I want to leave this reflection with you as a humanitarian entity. We can do investigation based upon the data. We have to protect the name. We have to protect the location. But all the other realities have to be systematized to leave evidence towards the authorities who have to ensure the rights to build public policies. And also that the humanitarian work can be well valued. So we're fortunate to have an investigation, a published book, the first investigation that is related with the migration work, and also with the human trafficking. There's a comparable study that was done in Peru and in Ecuador, adapted to the national context, and the Chalfa in Ecuador. Very soon you're going to get to download the book. Finally, with innovation, We wanted to let you know that we were happy to work with our ally. We work, does the same work, we world in Peru and Chalfa in Ecuador, but it's always a challenge with allies to agree. And it's always good. We have our own methodologies. We follow the procedure of Chalfa. And why would I ask Red Cross or why will I ask Save the Children how they do it if I already know how to do it? But if we really want to be a humanitarian alliance, we have to work together with the members of this alliance who are part of the same work group, and we have to reach upon minimum agreements. The standards are there, but the operational work and the territory of coverage and those on terrain, how are we going to do this? Can we do it together? 2 years it has been possible. We have had a perfect experience, and on the two sides of the border of south of Ecuador, execute in Peru and execute in Ecuador, a successful program with displaced migrants and families. Upcoming slide, I want to tell you what we think is innovation in regards to protection. This focus on protection that we want to give to those who have been forced to migrate has to do with two components. The first one is the integration for integrative education, in which there you can see it's a strategy that we have already spoken about these days. But this education inclusion is not sustainable if we cannot get the socio-economical inclusion for caregivers, for the parents. So we say we have to work in protection, yes, but we have to ensure the livestock integration, xenophobia prevention, for sure. We're going to have to work with other actors far and beyond only than childhood, national authorities and other authorities that participate with the well-being of childhood, and not all of them have the same comprehension of protection for children. So something we can tell you is that the innovative protection, that differentiation that we have to do in protection is to work with the families, to work with the community, with the local authorities at the same time. Is not only a work at the schools or only the communities. We develop these strategies in 3 work areas, and all of them in a timely manner together, and all of them need to do advocacy with all the authorities, the close-up with the community, and in this work, all of them alongside. If we don't do it that way, there will not be a balance. In this last slide, I'm going to share with you how is it that we do monitoring, because it's quite interesting for us. The program Lives in Dignity has some focus of implementation in the region, in Ecuador and Peru. We are the ones who are implementing, and we have a dashboard that allows us to monitor a lot. Our reach towards people, how many are host communities, how many are children, how many are adults, how many are elders. We have an important percentage, and there's always a number that calls our attentions and lets us see the reality of Ecuador. Why is it so high in the host community if it's a migration program? Refugees, what do you think? Because it should be like a 70% refugees, and that's what the conditions of the donors tell us. Why? In Ecuador, what happens is that the host communities, the one that's receiving the Venezuelan brothers, and we still continue receiving Colombians. Lately, the host community is the one that wants to migrate. They are the ones that are migrating. In the last year, 200,000 people left Ecuador. At least 50% of them crossed through El Darién, through Panama, to the U.S. And then we realized that the humanitarian work, when it's in regards to children migrating, has to open their eyes to the children arriving, but also the children that are exiting, the caregivers that are exiting, because the children are staying by themselves. And at the school, we have a great amount of children in the rural schools where we work in Cuenca. 30% of the children are without their parents. They're with caregivers, uncles,
Grandparents, other families, and their children affected by the migration, yes. They're not migrants, they're not migrating, but they have been affected by migration, a forceful migration caused by violence, criminal actions, and everything that has to do with safety in Ecuador, and somebody has to look into it. Humanitarian workers, we're not only focused, we should not only open our eyes for those arriving, but the boys and girls that are staying by themselves without parents and caregivers affected by the migration. With this, I close my intervention. Go ahead, Sassy.
All right, thank you so much, Maria. Ceci, can you please give us a deep dive as well into our Protective Passage program? Yeah?
Muchas gracias, Khadija. Muchas gracias, María.
Thank you, Khadija. Thanks, Maria. Good morning to one and all. Before I begin with my presentation, I want to ask you for your support to present our video, please. We had to take days, night through the jungle with our children, struggling, looking for how we could look for well-being and a future for them. And with faith, we believe that we're going to give them a good future. This is all that I can tell you. On the application, we have where you're going to narrate while is it that you left your country. If it's threats, economy, politics, I can help you. Right now, I'm attending to some children. They came that I could do the application of refugee. I helped them fill out the application. They came for me to help them with their humanitarian visa. All our services are free. In case that you did not, there's a number there. You can send a message by WhatsApp to get an appointment with us. We have seen the areas. We have found a lot of people that don't know that there's medical and psychological assistance. I recommend that you go to Comar's office that is downtown. Take your proof that has your picture and go and ask if there's a date for your interview. You will use this cream, but before you have to clean your legs, clean off your legs. You should do this in the morning, and in the afternoon, we provide cares in colonies or spaces. So in Comar's, we have other organization. The health centers and the government centers have a limit of patients. So since it's the population, the foreign migrant population, they're set aside. When I tell you, you're going to breathe in deeply. Now, breathe out when I tell you to. Can you breathe? Once again. I'm coming from Nicaragua. I've had the opportunity that I can get legal advice in regards to my process to obtain a permit permanently in the country, and the free medical care from Dr. Alexis. And she has been so kind, the way that they have attended to us. They give us medicines for free, and the care is free. So we were protected. It has helped us a lot. They have always given us a hand, an assistance. So we hope that we continue getting their support, that together we can continue carrying out the mobility, those whom are in mobility. It's a great solution to so many problems that we have daily with the migrants. So protected passage, protected path, what we can contribute, it's something that means a lot to them, and it's very comforting to us. I always wanted to exercise my profession into something that I can help people. I feel very happy to be part of this great task and this great multidisciplinary team, and I'm so proud of it. Something that I like so much is that it's linked with my beliefs, my values, the way that I always wanted to develop my life.
Gracias. Y de igual forma.
Thank you. In the same manner, I want to make use of this opportunity to ask for a minute of recognition and your support with a round of applause with all our teams on the field for those whom are here present, whom work directly with the population, because without the help of all of you, it would not be possible. A round of applause.
Listo. Muchas gracias. Y pues.
Thank you. So, I would like to share with you the different experiences that we have had from the Child Fund Protected Pathway. I want to greet our colleagues from Educo who implemented the program in El Salvador. Through the international plan, they participated in the implementation of this program regionally. We want to send them a warm greeting. Something that I would like to share with you, and that for sure those who have worked or are working on mobility, our population is quite diverse, and the needs and the challenges of the population change constantly, and our objectives are also being transformed constantly. One of the main challenges that the population has is to access services. When they get this access, as one of my colleagues on the field stated, they confront other levels of challenges, xenophobia, discrimination, the language barriers. And that is where we come in, and then we define which is our objective, our central objective as a program, which is to reduce the gap into the access of services, to provide the basic services, sometimes to provide medicine, also protection, and psychosocial care. Something that is very important for our program is not to leave anyone behind, that the services will be available not only for those who are refugees, but those who are seeking it, but for those whom are in transit. Another important point is that when we choose the profile of those whom we're going to attend to, in Mexico, unfortunately, we have very high levels of poverty and very high levels in regards to the access of services. So every service that the program offers are available for the local communities and the origin communities. And this not has only helped us that the population will have access to the service, but it has diminished the xenophobia, in which usually when a new organization arrives to the municipalities or to the entities, what we usually would hear, it's another organization that's only here to help the migrants. So it's very difficult, that contact and that communication with the local communities. But when they also have access to these services, then it changes their way of thinking and the integration opens up much more. Now, so where is it that we have these activities and how is it that we accomplish it? Currently, we have a presence in Mexico in two of the most important borders, south border in Chiapas y Tabasco. We cover three of the main entry points. One of them is Tapachula, that covers Hidalgo and Telemas and the central corridor, and they come through with Cumalapa border. And it's an entity that currently is completely taken by organized crime. On the other side, Tenosique. And the other spaces in which we have also activities, the North Zone in Tamaulipas, in the zone of Reynosa and New Laredo, is in the context, a complicated context, because unfortunately these are one of the two of the main points in where organized crime is located, and the population becomes even more vulnerable in regards to human trafficking, and they are also captured to become part of these organized crime. How do we work, or how do we implement our program? When we were on the design of this program, we asked ourselves, how are we going to get to the population? It's thousands of people that come into our country. And we asked ourselves, how can we access or help them to access these services? What we did was a mapping of which are the spaces where they're already getting that assistance. And the majority of these spaces already have years providing these services, and generally they do not have access to economical resources to widen the services or protection that they already offer, so they only become shelter or providing meals. We realized that what we could do was to strengthen the capacities of these spaces and to work together, that there could be more care, the one that we can give to the population. And this way we have activities in 12 different shelters or offices of care or attention. Very well. Which are the services that we provide? We realize that the complementary services that are needed at these shelters are related to the medical care that can be offered to the population, the psychosocial services that has to do with psychological services, or also social work for the follow-up of these cases. For this reason, we design a strategy of care. We assign multidisciplinary groups to these shelters, with the particularity that we don't have limited activities, and these teams are there continually from Monday to Friday providing these services on a regular schedule that they can access, that the population can access these services. One of the commitments that we have with this is to make it that the population can feel dignity when they're transiting through our country. The 4 professions that we can assign to the spaces are from the area of medical attention, psychological attention, social work, and legal. These teams work through 3 main areas for us, and the first objective is exactly the access to health, with an access in the first level of care. What our teams do is that the common illnesses, chronic degenerative diseases, which are constant in our population, gastrointestinal and respiratory diseases, curing allergies, that come many times, that the majority of the population that we receive or coming from a pathway from El Darién, as our colleague was sharing with us, and then they're affected and they arrive with this to our zone of implementation with these problems. The two other objectives that we have them as individual objective is something that we work on together hand in hand, and one of them is a topic of protection to children, and one of them has to do with violence based on gender. They could look like different topics, but for us they go hand in hand, intersectorial. And in both of them, we work on strengthening the capacities of our teams, that we can identify the needs and do the necessary referrals. And a great challenge that we have on both of them is to facilitate or improve their relationship at the shelters with the government. Unfortunately, in our country, there's a lack of trust to go to the public institutions, and part of our work is to soften this and to share the importance of collaborative work. Another important component for our program is the response that we provide and what we refer to the emergency in emergencies. The population that comes into the country, that the shelters are not enough and they're at their maximum capacity, and the majority of the population lives in irregular places, improvised places. So we have the task that we are the ones that take the services to the population in the communities and in the crisis. Amongst them, the caravans. The caravans, we don't experiment them like it was in 2018. But the reality is that our spaces, we still have these vast group of people that are transiting through the country and that are requiring the care at that moment. Another aspect that is important for me to share with you, and I'm very happy that I can talk about this topic, is self-care with the teams on the field. So we have the commitment of the responsibility that our populations are not the only ones that we take care of and on site, but those whom give the services. We are proud to share that we have a low index, or low numbers of those that resign. We have colleagues that have been with us from day one until now, whom are working on the topic of mobility. We know that it's very difficult. Generally, the teams on the field only last a couple of months, a year, and then there's a change of personnel constantly. But the strengthening of this culture of self-care has been important in implementing the services.
Sorry. And just very quickly, in this section of self-care, something very basic that we can implement is to name it, point it out. Unfortunately, many of our teams on the field come from contexts where they don't get support on this topic. So just naming it, pointing it out. Remember that something that you don't talk about doesn't exist. So we have to promote it within your teams. And going very briefly over these statistics, these 73,237 is about the amount of people we have provided attention to, and on average every subject has received 2 to 3 sessions, so we can estimate how many sessions we have covered. Out of that, 27% of our population is boys, girls, and adolescents. And I am going to cover this briefly because we already shared our partners, but we're going to retake this later on, the importance of collaborating with other agencies. Gracias.
5 minutes? Okay, this timekeeping job is like super difficult, so I apologize for running a little bit late. Thank you so much, Ceci. We have 1 minute left, as a matter of fact, so we would really like to do this mentee exercise very quickly with you guys. So if you would please scan the barcode. Yeah.
Gracias, que diga. Vamos a
Thank you very much. And we are going to answer this. If you can scan that code, or perhaps you can see the access code if you want to use. First question is, where are we from? I am going to, yeah, we can switch the slide. We can see the responses of the ones who have finished. Where are you from? None yet. Maybe refresh, because I see some. So we have people from Colombia, Brazil, Iran, Afghanistan, Guatemala. Thank you. Thank you for sharing your countries of origin. In which areas do you work on? You can choose one, you can choose several. If you can click which thematic areas you worked on. So I think many of us work on education, on child protection, most of us. So you can see that ranking, how we're supporting and where we could work together would be interesting. Next question. Strategies to promote education inclusion you have done during the last 4 years. You can choose one or several of the ones you have worked on the field. We have online education, accelerated learning. We know it's a challenge and strengthening of teachers, but doubtlessly we work with learning community centers is the most common one. The next question is the agreement or not we have on strategies to work on health and mental health. We have this responsibility of providing services that are definitely denied to most of the population in Latin America regarding health and mental health. We have mobile clinics, psychosocial support, self-care for caregivers, for families, teachers, psychological first aid. We all share the same thought that we know that mental health is important and to take care of the caregiver. Thank you for your answers. Next question is protection mechanisms your NGO has used during the last 4 years. Regarding protection, we know the challenge of having regular document, visa, having the app for refugees. It's important for people who arrive to a new country without knowing the context or the reality, and also legal rights. Very good. So let's go to the last question. So one more. Domenico tells me that we have to wrap it up. Okay, so what's the reason why we want you to leave your name here? These are the names that make a difference and make a difference in humanitarian work. So thank you for sharing your experience with us.
Attending this session with us, and apologies for running a little bit late. As we can see, just like very quick closing remarks, we have seen across both programs and the other third program, Confio, that I have mentioned within the evidence review, quite overlapping themes, as a matter of fact. So we have discussed the importance of having a multi-sectoral approach towards any Children on the Move program. We looked at the importance of really integrating mainstreaming, of course, child protection while integrating a gender and inclusive approach, mental health as well, livelihoods, education, and so on. And we have talked endlessly about the importance of the localization approach and our local partners. So thank you so much, everybody, for attending this session, and please reach out to us. So yeah, thank you. Thank you, everybody. Thank you.
Okay, well, if you're staying in the room, we now have our
session from the Accountability to Children initiative. It's going to be an interactive session, so you'll be up on your feet, you'll be in group work, so just sharing that in case it helps you to decide whether to stay or whether to go. We'll be wanting to hear from you and engage you. For those of you who are staying in the room, just by open the door there, Joanna Wedge, the lovely Joanna Wedge, who you met yesterday morning for the Getting to Know Each Other exercise, has some stickers, and you can tell us who you are. We want to know who is in the room for this session. So if you can, if you're able to stand up and go to the flip chart by the door and stick a sticker to tell us a bit about who you are, and then you can come back to your seat. Hopefully we'll then have any additional participants and we'll formally start the session. Thank you. No, we'll have to just go over by 10 minutes. Okay. So one, yeah, and then I'll start the next one 10 minutes later. If we catch up, I know, but what can we do? We can't make an hour session 50 minutes really, so. It's only a problem if they want to go to one downstairs, isn't it, or next door? So we have to try and catch up first. Okay, and then we also have a participant list. We have a participant list that we'll be passing around in case you want to sign up to mailings. But if you don't, we'd love to just at least know who was in the room. So feel free to put who you are, and then if you want mailings, you can also put your contact details. There's a few of them on different tables. Yeah, go in and entice. Do you want me to entice for this? Yeah. So if you want to come and sit round a table with people